Let's call this meeting to order. The ARPA Strategic and Outcome Commissions. First thing is the public comments. Anyone alongside or behind us wishing to speak on anything today on the agenda may do so, and then we'll go to the ones on Zoom afterwards. So if anyone would like to start talking on anything, state your name and address, please.
Yes. Hi, I'm Brandon Hennis, City Administrator for City of Omro, home address 325 Quincy Avenue in Omro. I'd like to thank the ARPA Commission today for tabling the City of Omro's submission from the last meeting to this one. Terribly sorry again about not being at the last one. It's a miscommunication on our part. I just wanted to take a moment to introduce myself again. I'm the new City Administrator, started in October of 2023, so relatively new in the role. The initial application for the ARPA and stuff was done prior to myself beginning, but very much looking forward to the discussions and possible action taken by the ARPA Commission meeting. I wanted to also introduce the team that I brought along with me. Right here is Pete Hennis, no relation, City Council member for the City of Omro. We have Dan Rammer, an engineer from MSA. We have Steve Bilkey, our Director of Public Works, and Steve Jungworth, our Mayor. The whole city is behind this entire project. It is a project in dire needs due to just the useful life of the entire main infiltration system within there. And when it comes time for you all to discuss and have possible actions with it, if you have technical questions or anything, we are here to answer them, and I'll lean a lot more on Dan and Steve Bilkey to talk about it. So that's just my 1 minute soapbox, and that's it. Thank you.
Anyone else wishing to speak to the mission?
Hi, I'm Dr. Bill Topol. I am resident of Oshkosh, 1476 Wellington Court, and I also happen to be the county's Human Services Director. I typically don't weigh in public comments on anything that you would be discussing, but I felt that I need to say a couple things about a couple of items on your agenda today. The first one being Nova. I've had a 30-year relationship with Nova in 2 different counties, hundreds of thousands of dollars worth of services that Nova, as a licensed treatment residential facility of 28 days, has performed in the 2 counties I've managed. I have never had them not be cooperative with providing any financials that we've ever asked for. I spoke with Jody Williford, the current executive director. She stated to me that she's never denied anybody financial access to her records. I believe that to be true. She also told me that she is working on a board conflict of interest policy. I have never in my 30 years ever had a complaint that I heard about relative to their board having a conflict of interest, but she realizes that they need to do that. So I am in 100% support of the commission adopting their request. They will be doing the only female residential 28-day service in the area. There's only a handful of providers left in the state that even provides 28-day residential for alcohol and drug abuse. And I very much feel it important enough for me to say something today that please don't not support it. 2 other things real quick. One, the pillars request, definitely supported that. It doesn't really make it clear in the pillars request of 50,000 that their service in that area is in Winnebago County. Even though Pillars is in Appleton, the service they're talking about enhancing with the 50,000 is actually in the city of Neenah International for young adults. So please consider that important. I do. And lastly, I'd ask you to consider a 1-month postponement of the first 5 Fox Valley proposal. There's a brand new program in the state of Wisconsin that is doing navigator services for children, and much like they're proposing in their request to you, I just want to make sure that there is no duplication of service. We all kind of have a navigator function, including some of my department. I just want to make sure that we're all on the same page, and I want to get around and support first 5 Fox Valley's request, but I do think it's prudent to hold off at least a month so I can further investigate that and give you my support. And that's all I have to share today. Thank you.
Thank you. Anyone else wishing to speak? Come right forward, please.
Good afternoon, Commission. Thank you so much for letting me speak. My name's Beth Clay. I'm the Executive Director of the Northeast Wisconsin Mental Health Connection, which is a tri-county coalition, a membership coalition that works on systems change issues in mental health and suicide prevention. So Winnebago, Allegheny, and Calumet counties are our tri-county area. And most of the organizations that you know, in fact, all of the ones that were mentioned here today are members of the connection. We all sort of pledge to work together on things that are above and beyond any individual organization's strategic plan, but that affect the entire system of care or all the people that we serve. And so one of these projects is before you today, not for the existence of the project. It's fully funded, and I want to make that really, really clear. I'm not asking for the ongoing maintenance fund of this or for any of the sort of normal maintenance updates that happen. This is for something very specific as a quality improvement effort. So what we have here is an extension of a project that we call No Round Door, which is about people being able to access services in a very complex system. We all know how complicated the mental health system of care is. In fact, the people inside the system can't navigate it. And so even providers use this resource. It's a product called Network of Care, which is a web design that's created to help regular people navigate a complex system of care. It's a very user-friendly website that allows people to get quick treatment, quick access to treatment, support and recovery services. It also has mental health screening tools on there, which we've seen about a 550% increase of usage of those screening tools since the beginning of the pandemic. So people are really wondering, am I okay? Is what I'm experiencing normal? Do I need to access care? And then if I do, finding their way there. You can see I provided a one-pager here for you to just give you a quick snapshot of like, how does this thing work? Who uses it? So you can see we've had, since its beginning, which was in 2017, this is a very well-established community tool. Starting in 2017, and we've had just an increase in the usage. We have now about 280 visits to the site a day. Totaling over, 500,000 site visits over the time that it's been in existence. Our biggest users are actually in Winnebago County, city of Oshkosh. About 70% of the people that use the site. It's a way to, one of our most visited pages is actually our crisis page, which is so interesting to me because in a crisis, why the heck are people on this website? But it shows us that people don't know where to go. And so having one place to go, having this one right door when there's so many wrong doors is really, really critical. What we're asking for is the thing that's made this site so successful is that we use the analytics of the site to help drive the quality improvement projects we do. So who is using it? What are they accessing? What questions are they looking up in the library? Who is taking what kinds of screening tools? And so we've learned a lot about what's needed inside kind of the post-pandemic world. And there are some groups that were particularly at risk that we want to make sure that we put landing spaces for them on the site so that they can find their way quickly. One of those really important things, as you probably are aware, wait lists for outpatient mental health care are between 2 and 18 months, depending on what kind of services you need. One of the most critical pieces we want to add on there is called While You Wait. So what is available to you while you're on that wait list so that you're not going into crisis and ending up in an emergency room with law enforcement on a Chapter 51, on all of the really expensive services. How can we help you while you're on that wait list? That's a really critical piece. And then we have some groups that have shown to be very vulnerable during this time that we want to have some services that show up right away on the website for them. And those quality improvements are the pieces that we're asking. So it's sort of like a capital investment, right? It's a one-time thing. We will not continue to pay fees to maintain these improvements. It's a one-time cost, the ability to sort of make all of this access to all the people. And many of the folks that you guys have in Winnebago County, so from public health to law enforcement, everybody else, they are also navigators that use this site. So it's not just the general public, but school psychologists and, you know, the sheriff's department and people from WIC and all the folks that you help serve are using the site to navigate. So thank you so much for letting me be here today.
But question here.
Yeah.
Yeah, when you said, connects to, crisis, centers, crisis teams, is that connected directly to our crisis?
It is.
Okay,
Yep.
all right, thank you.
Yeah, thank you. Oh, great.
Can I ask just a clarifying, in one of your latest responses, you said that you had some unexpected positive additional funding, is that correct? So your original request was for 90, and you thought 75 is where you needed to land for the 3 years?
That's correct.
Okay, I just want to make sure before I share that I had that correct.
Yeah.
So,
Thank you so much. Appreciate that. Thank you, Ernest.
Bill, thank you.
Good afternoon, Commission. My name is Sandy Drexler. I'm CEO of Tri-County Dental. I live at 36 Meadowbrook Court, Hamilton, Wisconsin, and with me I have Dr. Phil Flora.
And I live in Neenah, Wisconsin, 1140 Glenholmes Lane, and I am a founding member of the Tri-County Community Dental Clinic that was started back in 2003. And
Go ahead.
as a founding member, back in 2003, the need for dental care of our low-income patients and patients on Medicare was going off the roof, and we had no providers providing the service based on the reimbursement that the state was giving the dental profession. As a result of that, this clinic was started 20 years. A need that is fulfilled and is so much more demanding now with the numbers that are coming into the system because of low income and the increased number of Medicaid population. We service the Winnebago, Outagamie, and Calumet areas, as the Tri-County would explain. Our services are mainly into the Medicaid population and the low-income population. One of the critical things that we see in the low-income or the Medicaid population are the children. They are the ones most at risk for dental disease. Obviously, you all know dental disease because you probably all had fillings or a toothache. The number one problem with a child getting a toothache is it really debilitates them. Loss of school time, loss of parent time trying to get them to some need. And back in 2003, there was very few places that would accept. We're there and we accept Medicaid and that low income population without refute. They pay basically nothing. Bottom line is that need is getting greater, and obviously professionals still aren't taking care of it because the reimbursement rate is less than 28%. And that's why the average professional cannot take them into their office if their office overhead is at 50%. Bottom line is we're looking at the things that you have on your agenda. How do we treat these young children in a care and efficient way? And some of the equipment that we're putting on here is instant equipment that would help us tremendously. MetroCam pieces for lasers, to the point where if we have to take out a front tooth in a teenager or a front tooth in our veteran population, because they also qualify for our services, we don't replace that missing tooth. There is a procedure and a computer technology that can make us replace that tooth rather quickly. We've got a lot of things that we are asking for. All of them are dental related in a very needed way. I mean, you know, when you have a child that's in first grade and has a toothache, they have no place to go other than the emergency room, and they don't take care of anything other than give them an antibiotic and pain medication, and then we're the next step for them.
So if you look at your handout in front of you, you have a picture of two people. June came to us when she was 7 years old. When she came to us, she needed to have 7 fillings and 2 extractions. And I asked you, I told you, you had to have 7 teeth filled and 2 extractions. Would you be able to smile like this afterwards? And at 7 years old, she already needed us a lot. And that type of care is something that you need to have multiple services. You can't usually do that on one visit. So as you think about it, a lot of our work is geared at the kids like June. 2/3 of the people we see are children. We take our mobile clinic out, we see kids in our clinic in site. And when we start to look at June, having her have a good experience is vitally important because we want her to want to come back. We want her to take care of her teeth. So a lot of our equipment is about how do we make this experience really good for her? When people walk into our clinic, a lot of times if someone is drilling a tooth, they'll go, ooh, there's that sound. I hate that sound. So as you start to look at our dental lasers, for example, they can remove the decay from a child's tooth without pain, without the sound of a drill, and without anesthesia. When you look at some of the other things that we have in our proposal, it is again designed to make the experience really good. We've asked our pediatric dentists, what would it be like if the patients were able to look up at a TV screen and watch that as they're there? They said two things. Number one, it's digital sedation. Number two, you can think about it like TV anesthesia. We have a pediatric dentist who comes in on a monthly basis, and as I was sitting in my office on Friday, I heard a child crying, screaming for about 10 minutes. And I said, oh, Dr. Eggert must be here today because I can hear. And I pulled up our schedule and I looked and I went, oh, she's not, it's a different doctor. Then I looked over a couple of columns and I went, she is here. And unfortunately, a lot of times by the time children get to us, they have that much work. It's so extensive and it's a traumatic experience. And I said, Dr. Eggert, what would it do for you if you could have those TV screens over the chair? And she said, it would make it so much better, not even for me, but really for that child. And our goal is to make our children's teeth here as healthy as we possibly can, to care for our veterans now and into the future. We're happy to answer any questions that you might have.
Sure. Yes. Based on, reading I've done and specific to your request for funding, can you elaborate more on the schools that you serve in Winnebago County? And how many?
Sure, we go to 25 schools in Oshkosh and Neenah. And much of our care is done on our mobile clinic there. So part of our ask, our mobile clinic is very expensive. Value is $700,000 to $800,000, and you can't just leave it sitting out in the back lot. It has to be in a heated space that is large enough, that has running water. So when we take it out to a school, we're able to do a number of different types of work on it. We can do dental hygiene, we do dental screenings as well. We do a lot of restorative work. We will do fillings there, but not extractions. So we try to have it out 5 days a week. During the school year, we're also talking with schools now, how do we continue that access during summer, going out to the schools that aren't served as much, so middle schools, because we focus right now on grade schools. And I would say we figured about 1,500 kids in Winnebago County were seen last year on our mobile clinic.
Do you service Winnebago County or Amo or both?
We don't right now. Part of it is because as we start to look, we have to have a certain population in a school in order to be able to make our taking the mobile clinic there effective cost-wise. It costs roughly $1,700 to $2,000 every time we take the mobile clinic out. And you have to see enough kids to be able to generate enough revenue at that 28% reimbursement to make it worthwhile. So that's another thing as we start to look at summers. We haven't gone to those cities in our school year, so we're very willing to look at, seeing if we can connect and get enough kids, enough population to make it worth taking out there.
I would assume they did the same dental issues, yeah. So-
They sure do.
It hasn't changed in 20 years.
First, I want to thank you, as a dental organization for even accepting Medicaid and Medicare. As somebody who was struggling in my life with the kids, they are very hard to find. So thank you for that. That's I think people should realize how rare that is in this county, that a dentist actually accepts Medicaid and Medicare. I echo the same concerns here, but it sounds that if we can figure out how to get the kids together and have enough, and we'd be more than willing to go up to Winnebago County or Amo, or maybe we can come up with some kind of a fair to get those populations together. And I think that would be very, very helpful. But my question for you that I wasn't really quite sure of, that you kind of brought it up when you talked about veterans. How are you able to accept VA patients? Or is that tricky?
No, they have to qualify through the veterans. The Veterans Association has a way to qualify. Obviously, you have to be in a low income group. But there are a lot of veterans that we saw from the Vietnam War that hasn't seen the dentist since they came back. And it's to go, so they're stuck in that scenario. The VA does have a dental clinic in Milwaukee and one in Green Bay.
Right.
However, the fellows that live here, a lot of times they don't have transportation. And so they're limited by bus, and we're right in the middle.
So I will tell you too, as you look at Tim, who's on our page here, I went and did a presentation at Veterans Village about our programs, and he came to me and said, I tried to do the right thing. I bought some dental insurance, but I learned that it really doesn't provide me any coverage. So I said, you come talk to us, and he came in, we were able to do a lot of care for him. And what I learned was he was my junior high school music teacher. I was like, oh my gosh, it's Mr. Brickham. He was the nicest man, and there was a personal tie to him, and we were able to work on his teeth. And as we talk about what could we do, a lot of our work, we do great work. We want to enhance what we do, but also how do we expand? So as you look at Mr. Brickham's teeth, he's missing a tooth up here that we had to take out. With one of the new pieces of equipment that we're proposing we'd be able to make that tooth for him and get it in within a visit or two. So we're working hard to expand and see as many veterans as we can, as long as you're honorably discharged, and as Dr. Flores said, qualify with income, and we'll see you.
And our bus is out here. You see, I'm sure most of you have seen this bus drive around. This is such a critical part of what we do. See those kids in the school system, take their parents out of the equation so they can still work and see their children. Without the bus, the children, we're seeing half of them, so it's so critical for our whole operation.
And equally importantly too, that means that the amount of time that the children are out of school is significantly decreased. So they come out just for the time that they see us, rather than having to get into a vehicle, get bussed up to the clinic, sit there. So rather than 4 hours, it'll be a 45-minute visit. Ultimately, leading them to have a better education and to succeed more and more. Great questions. Other questions for us?
Well, thank you very much. We'll discuss it further.
Thank you.
Anyone else wishing to speak?
Hi there, I'm Ryan Krings, the fire chief with Winnie County Flooding Fire District. I live at 195 Twin Harbor Drive in Winnie County. I come to here today to talk to you about item D3 on your agenda, the airboats at Winnie County, Neenah, Menasha, and City of Oshkosh Fire Departments. I had originally submitted a request for, I believe, $300,000 from your committee to purchase a new airboat for the Winnie County Flooding Fire District. I come here today with an understanding that the potential of a federal grant hopefully coming in the near future, the chance of Winnie County Flooding Fire District being reconsidered for allocation of spirit fund in the amount of $300,000 is highly unlikely, as the federal grant would provide a new boat to each of the 3 fire departments currently operating the Husky airboats. Unless Sheriff Motts has additional information, I would ask today that spirit funds in the amount of $900,000 or equal to the amount requested in the federal grant be set aside for the period of time it takes to receive notification of acceptance or denial of the federal grant. If the federal grant is awarded and funds allocated, the 3 new airboats will be immediately ordered to ensure availability for the emergency response of as the 2024-2025 ice season arrives in November or December. The set aside spirit funds could then be freed up and allocated for other projects at the discretion of the committee. If the federal grant is denied, the set aside spirit fund would be immediately utilized to order the 3 new boats. So my purpose today is not to continue to ask for the funding for Winnie County to get their own boat. I understand there's a federal grant and hopefully that's gonna happen. My intent is for you to hopefully set aside some money in the event that that grant does not happen. We still have the availability to purchase those boats this year. Thank you. Yeah.
John. This way, would you take ownership of the boats?
No.
Or would it still be the sheriff's?
Still remain a sheriff. Any other questions?
We have enough coverage for this year, which is gonna be a tough year.
I think so. We still have, Winnie County boats still operational. City of Oshkosh boat 15 is operational, and we have a lease boat that we're operating out of Neenah, Menasha right now. So we do have the three, I guess, county boats are still available.
Good luck this year.
Thank you. Hopefully it goes away next week, so thank you.
For those of you watching at home, no ice is safe ice, right?
Anyone else in the audience wish to speak to the commission?
Hello, thank you. My name is Lana Erickson. I work here as a supervisor in the public health department. I'm also a local Oshkosh resident. I've been with Winnebago County for 8 years. I'm here to support the partners that are applying for funds that support our young families, particularly the request from First by Fox Valley and Child Care Resource and Report that you'll review today. In April of 2019, the Winnebago County Board of Supervisors passed a resolution that supports investment in young children and families from prenatal to age 3. And I have a few copies of that you guys passed. That came about because of multiple partners in the Fox Valley region that had formed an alliance in early childhood intervention and education. And this was made up of partners from Human Services, Parent Connection, Birth to 3, UW Extension. And at the time, we knew that our children were falling behind and that earlier intervention needed to happen. Since then, that coalition has been renamed First by Fox Valley. And there wasn't money at the time in 2019 to really put it into something, but now we have it and this is our opportunity. Funds like this could help us actualize a local navigator for us. And this navigator has already been placed in Outagamie and Wapax counties. There is no localized one here in Winnebago. I know that Phil mentioned Wayfinder. That is a specific app that's coming up, but it's particular to families with disabilities and special healthcare needs. Help Me Grow is a more broad system, and it's actually a national model that we piloted here in the Northeast region, and now the entire state is looking at us to lead the way with that. So again, I just want to reiterate, these partners have been working with us for decades. We've come along with the data, we've given our advice, and here's the opportunity to fund some of those. Thank you.
Anyone else in the audience? Anyone else? If not, Supervisor Hanson, see your hand up.
Thank you, Mr. Chairman. I do appreciate the opportunity. First and for the record, Supervisor Hanson, District 26. I want to make very clear that I am not now, nor have I ever argued the merit of any resolution or project that has gone through and been considered at this committee. The enigma that I have is a fiduciary responsibility to the county. The original intent of the ARPA and Spirit funds was to replace lost revenue to the county. Now, on January 2nd, 2024, Director Elder outlined a 10-year need of anywhere between $80 and $100 million, and that's of need by the county, and that's just for our buildings. Prior to the January 16, 2024 vote by the board that did advance resolutions through the Spirit funds, approximately 31 to 38% of that need could have been funded. We also considered Resolution 315-01 2024. That was the capital improvement projects for 2024. Every bit of that could have been funded and stamped paid with the Spirit funds. That's $10,060,605. I am wrestling with how a good legacy is not a fiscal responsibility to the residents of this county. Thank you.
Thank you. Is there anyone else? Tracy, I see your hand is up. Or Candy, I'm sorry, Candy.
Tracy is first.
Tracy,
Hello, can you hear me? I'm having a hard time getting my video to work.
yes.
My name's Tracy Gerke. I reside at 5386 Bay Breeze Drive in Amro. I speak to you today as a public health nurse for Winnebago County since 1999 and the current board president of Child Care Resource and Referral. In 2000, the health officer at the time recognized that mothers were returning to work 6 to 8 weeks after delivery and wanted to provide continuous support to young families. This answer was to meet families where they go, and that place is childcare. I was asked to take on this new role as a childcare nurse consultant. I considered myself a pioneer in shaping this role and was one of the first in the state to build relationships with the childcare community. To begin this journey, I focused on educational topics for children, parents, and staff. At first, I met some resistance from childcare programs. As time went by, I became a reliable resource for questions ranging from developmental concerns to communicable disease issues. Today, I still provide phone consultation and now actively involved on the Child Care Resource and Referral Board for 5 years. The landscape of childcare has changed over 25 years. I remember a time you could arrange childcare for your children after delivery. Those days are long gone. Now, to secure quality childcare options, families need to get on wait lists that last a year or longer. 42% of the programs in Winnebago County don't have enough qualified staff to fill the slots they're licensed for. To put this in perspective, a program in Neenah is licensed for 69 children, but only has 32 enrolled because they can't fill their teacher vacancies to open those slots for care. Plus, their current staff need time off to rejuvenate and take care of themselves so they can provide the best care to the children. We know that current childcare crisis is a multifaceted issue and cannot be solved overnight, but we can make small steps to improve the landscape of childcare environments by offering a substitute program in Winnebago County for when staff need time off or are just simply ill. This relieves the stress from directors working in rooms or scrambling staff around to keep rooms open for the day. I do know one thing that hasn't changed over 25 years is we need childcare to have a prosperous workforce and community. Aren't children the legacy of our community? So let's invest in the children by making a statement that Winnebago County supports young families and childcare programs by starting a substitute program so they can keep their doors open. I thank you for your consideration today.
Thank you. Candy? Candy Hall?
Hello, my name is Candy Hall. I'm the Executive Director at Child Care Resource and Referral. I'm also an Oshkosh resident living at 1370 Tammy Road in Oshkosh. First, I'd like to say thank you for allowing me a few minutes of your time. You've heard our agency speak the last few months on the importance of supporting childcare providers in Winnebago County. We have 92 providers in the county, and our conversations with providers often daily contain language about how they don't know how much longer they can do this without some support. We at CCRNR support them with training and mentoring. We do coaching and support in other small ways, sometimes just letting them vent about the frustrations of the day can be helpful for them. We also refer them to other services such as First 5 Fox Valley that helps with the developmental needs of some of the kiddos that also in turn helps with the staffing. Because if we can help the children with their behaviors or some of the challenges, we can also help the teachers and keep our workforce strong. All of those help, but what they need, as Tracy said, are people. People to keep their doors open when teachers don't show up, when they need a mental health day, or they need to care for their own families. The funds we've requested would support a substitute program to be available in programs similar to the ARPA funds we've used in Calumet, Wapaka, and Outagamie counties. We rolled out Outagamie counties, and in 2 months, our subs covered 528 hours of coverage in classrooms within an 8-week period. And we are confident that Winnebago County has the same or greater needs. So thank you for your consideration, and we do appreciate how hard these decisions are with the needs being so great. Thank you.
Barb?
Hello, this is Barb Tingestal with First 5 Fox Valley, and I think the person who spoke from Amro really made the case for what we're doing. In exactly the fact that we are serving 27 children in Amro at different programs from Wee Wisdom to the Learning Center and daycare at preschool. We have the firstborn with the welcome baby, a family that came through a firstborn experience at a hospital. We have 4 referrals from a healthcare provider in the area. And we're beginning to work now with Amro School District. It is a collaborative process, but all of those programs, all of those children are only supported by our navigators who are from Outagamie and Calumet counties. And just think of what we could do to do more intentional work in Winnebago County. Like Candy said, we don't duplicate services. We work collaboratively together. That's really intentional. in the work that we do. And the ARPA funds were also not only for understanding lost revenue, but they were also created to really realize who was hurt during this pandemic that we experienced. How do we address educational disparities? Who were the underserved folks that were most affected by negative impacts because of this? And that's the folks we're working with. We're actually doing developmental screenings on these young children who were just born or might be 2 or 3 years old during the pandemic. And we're seeing huge gaps in their developmental milestones, where they're falling behind, where they were falling behind. But now with the ongoing regular developmental screening, we're able to address that. We can address it, get those families the support, and hopefully those children, by the time they are in 3rd grade, are back up to reading at a regular 3rd grade reading level. It is this early intervention. It is our partnering with our partners, such as early intervention and parent connection and childcare resource referral in our school districts and our childcare programs. That's what we do with Help Me Grow. And I strongly encourage you to take a look again at our application that gives you the idea about how the depth of what we could actually do if we had a navigator placed in the communities in Winnebago County and Oshkosh and those rural counties. It would just be an immense support to getting kids back on track. I thank you for your time today and appreciate any questions you might have as you go through this process. Thank you.
Thank you. Deb Martin?
Hi, Deb Martin, 164 Wildwood Drive, Oshkosh. I just want to say that I'm very glad to see all of these things on your agenda for today. Appreciate that the money is getting out to people who need it in our county. I feel that the government has a responsibility to the children of our county, and that may be through First 5 Fox Valley. These are young kids, and we cannot abandon them for a building or for any other reason. And the dental care, that kind of put a stigma on them for years and years to come. So the ARPA funds were to help recover from our pandemic, and they should be spent that way. And I appreciate your time and thank you for the work you're doing.
Thank you. Anyone else on Zoom or in the public? Last call. Not seeing any, that part will be closed. Next, I will call on Cassie, our clerk, and I'm going to have her tell you why we got 2 sets of agendas this time.
So, because of the short turnaround time, we had to kind of turn right back into it. So I started creating the agenda last week through our normal previous process. And that's what was posted on Friday. That's what I sent to you electronically. Then on Monday, when we were gathering all the additional documentation, we put it through our new agenda prep software, which we were just beginning, an item got missed. So the one that is highlighted that's the one that you received electronically on Friday. It's got number 10 on there that says to continue prioritizing, selecting and funding amounts, blah, blah, blah. That is not on the one that's included in the packet. So with the new agenda prep software, it was an honest mistake. It just didn't get into that prep software, so it did not show up on that particular agenda. So, and then that packet is combined all together through that software. So that is the reason there is 2 different agendas. I spoke with Mary Ann this morning because that one was posted. We are still able to talk about that item.
We'll be following the one that was posted on Friday, because that was posted right on our, everything that was mailed out to all of you, and so that's the one that we'll be following, the first one. So, and then we also had a letter that come through with a thank you. You don't have to read the whole thing, just say who it's from and kind of what it's about, if you would, please.
So we received a letter on January 25th, 2024 from the City of Menasha Common Council, addressing the county board. but it was in reference to the funds for the $145,000 that was passed previously. I'm just gonna read that well, I'll just read the whole one. So, dear Winnebago County Board members, first and foremost, the city of Menasha was thrilled with your generous decision to implement the Winnebago County Spirit Funds Government Allocation Program with the intent to reinvest in Winnebago County's communities. Through this thoughtful determination, municipalities like the city of Menasha were able to bring forth and implement projects that will serve their citizens for years to come through various efforts of sustainability, emergency response, water quality, quality of life, and debt avoidance. Upon your review, the city of Menasha was approved to utilize the one-time dollar amount of $145,000 to install a 168.8 kilowatt, I believe, photovoltaic system on its public works facility at 455 Baldwin Street. Without these dollars, this project would not have been financially viable at this time. The Public Works Facility Solar Expansion Project will be funded by a combination of incentives, tax credits, Winnebago County Spirit Funds, and WPPI borrowing, with the remaining city portion about $55,000 to fund. We are eager to start this project because we will have a return on investment within 4 years of project completion.
Thank you. Next thing will be approval of the minutes from January 17th, 2024.
So move.
Second. Motion made and seconded. Any discussion? Any discussion?
It was a long read.
Any discussion?
Good job.
All those in favor signify by saying aye.
Aye.
Opposed, say nay. Carried. We will go ahead with update on the $145,000 spirit funds distribution.
Three counties or three municipalities have not received the funds yet. Town of McKymai, Town of Inland, Town of Wolf River. Town of McKymai, I received the documentation this morning, the remainder of it from the county clerks, Julie. So that will be going out Thursday to them. They should be receiving their $145,000 on Friday through an ACH. So that'll leave Town of Vinland and Town of Wolf River. I received from, I believe, Town of Vinland that they have about $38,000 of road work that was done in 2023. And they'll let me know what they're gonna do in 2024.
Okay. It's very good. You question?
How hard was it to get back on that flight from Hawaii? Come back here. Is it hard?
I was hoping for a delay.
Good work with this.
Review of interest earned on spirit fund. Oops, I'm
Can I
sorry.
interrupt? So I just got an email. Paul Eisen is the phone that's up on Zoom. And he would like to be unmuted so he can speak.
Okay, we'll just go through this interest and we'll unmute Paul. We'll go back to him then.
Make a motion.
Interest through the end of the year was, I believe Cassie sent that out, was $1,991,000. It's averaging about $3,700 a month. So that'd be about another $116,000 for January. I do not have in the payment to Christine Ann deducted out of that. So that'll affect interest calculation once I get back to redoing the calculation through the end of January. When I actually look it into the financials.
So that's all interest. There's no separate funds that set out or whatever. It's all.
Basically, there's the county bank account, checking account.
Oh, I'm talking
mutual
about just
money
for spirit and that, right?
We did not keep a separate spirit fund. Because I wanted to make sure I got the best interest we had, so we kept all the funds in the one money market or multiple money markets, basically. There's 5 or 6 different banks we have money markets with. So I moved the money to get the best, but we're using the interest rate that we're getting out of the money market from Associated. Their daily rate that we're getting from them is what I'm using to calculate the interest for ARPA. So they're not getting any of the old investments that are at 0.1%, and I'm not doing any of that. It's their funds. I'm saying we put into the money market, we left them there. they're getting that interest, which right now is I think about 5.18. It came down from 5.3.
Okay. Any yes, sir.
Thank you. I'd like to be a little more specific. So as I read the document, the interest is being accrued on $33,390,000 initially, correct?
Yeah.
We have two buckets of funding, 50% each.
Yeah.
Now, we have a resolution that, in my opinion, mandates that the commission can use the interest for defined projects. And I can elaborate on that different, but my question is the interest gonna be then separated? Because half of this amount of money is being used for county projects. The other half is being used, what we're identifying today, county identified projects. Are we gonna split the interest money and put half into each bucket?
I have not split it. I've not created another account. I've not added to my accounting nightmare at this point. So if you need
Isn't that
that,
gonna be a
if you need that done, when you have a resolution, then I'll put the document together to split it between the two categories. Right now, it's interest for ARPA.
So in essence, and I'm thinking we have available to this bucket that we're dealing with today, approximately $1 million, not 2 million.
For this 50%.
Yes,
Correct. Yeah.
correct.
Yeah, if you would look at it that way.
Just a point of clarification.
Right. Yeah.
Thank you.
Corporation Counsel.
Obviously, I want to see the resolution, but if the resolution specifically said the interest was not divided, it was just accumulated, then I wouldn't assume that you can put $1 million in the county identified community projects and the county fund. That would have to come from the county board. But again, I don't have the resolution in front of me. If you want to give me the number, I can look it up.
Okay, we can communicate on that at a later time.
Okay. Any other questions on this?
I
John?
just want to make a motion to open public comments back up.
Okay, second, motion made and second to open comments, public comments back up, to Supervisor Eisen. Open him up.
You need a vote on that?
All those in favor signify by saying aye.
Aye.
Opposed, say nay. Supervisor Eisen.
Never had one just with a phone call before, so I'm hoping he knows what to do on his end.
Supervisor Eisen, we're trying to get into you on your phone.
He's having trouble with no offices, so. You want me, because I got an email saying, can we put him on speakerphone, but it's up to you. I don't know this.
You got a cell number? Do it like we did last time.
If you want to try that. Anyone can't hear it very well.
Oh, he figured it out.
You did?
Yeah.
Verizon Wireless, your call cannot be completed.
He's unmuted.
Yeah, the line's going. Paul, are you there? Paul? He should be.
Am I unmuted?
Yes, you are, Paul. We can hear you.
Careful what you say.
Paul, can you hear us? We can hear you, Paul. Supervisor Eisen?
Chairman, maybe you should try the phone one more time.
We go through on mine either. Yes.
The supervisor has got a different phone number.
Put himself
Real
back
personal
on
there.
Verizon Wireless, your call cannot be completed as the call party is temporarily unavailable. Please try again later. Verizon Wireless.
What number do you have?
I have 920-734-1303.
Okay. I got a cell. I got a cell right here.
There you go. Call it the cell.
Not a town.
Welcome to the USA and my voicemail, 920-858-081. It's not available. Please leave your message after the tone.
Is he emailing with you?
No, I got my off, or Ann's emailing me.
Okay.
Do you want me to see what he wanted to speak
I was gonna
about?
say, if you wanted to email us public comments, we can just read it later if the chairman's okay with that.
Okay.
Right. So we can move on. We got a lot to cover.
Yeah.
Try this one. There's all numbers.
Discussion airboat housed at Winnebago, Poygan Fire Department, Oshkosh Fire Department, Nina Menasha Fire Departments. We did have, action on here one time, but we decided that maybe it should be up for discussion because there's a lot of discussion, what's happening, if there's a bill out there, if it's gonna be done or whatever, so at this time, this be discussion on what to do with this. Yes.
If it is going to be in the sheriff's department vote anyway, this would be a request off the top 50% administration ask. So I don't, if that is what you are requesting regardless of the funding, it wouldn't be coming out of this bucket anyways. Much like our radios, much like the expo center, that if it's equipment we are buying, it would be out of that top 50%. So I don't think we shouldn't hold money for something in this bottom 50% that wouldn't be there.
Yeah.
Does that make sense?
Yes, it does, if that is your premise. I requested it be on the agenda to clarify several issues. First of all, Supervisor Nelson, as you might recall, was concerned that Winnie County did not request radios. And that he thought they should be included. After I had been having discussions with the fire chief as to why the radios went on there in the first place, and he indicated to me it was because they wanted to get the boat. They considered that a priority. In my second discussion with him, he indicated it was a boat for the Winnie County Fire Department, their own personal boat. So I think we needed to clarify that going forward. That was the original request. Since all that has taken place, obviously, we have the grant funding issue and that kind of a request. I do support the initiative though, because my understanding is at the Ledge Committee, Senator Baldwin's aide indicated that it had been approved by the Senate.
Yeah.
But it has not been taken up by the House. And we all know where those two bodies are and working with each other. So in essence, given we have one boat that's down, I believe they've rented one to replace that. But this is a major safety concern. So I really would support and appreciate that if that funding does not come through from the Fed, how are we gonna fund it and how quickly can we fund it? Remember, somebody told me, what's the order time? 6 months out? You want 3 new boats? How long does it take to get them?
Yeah, it depends on what company we go with, but it is as short as 4 months, but as long as 9. So I'm 6 months.
Okay, hopefully that's gonna come in the summer, but if it doesn't, during a critical time in the winter, such as we might be approaching, the question is still pertinent. How are we gonna handle that if we have to, and we're put in that situation? So I look forward to your response.
My response is simple. I think if the funding falls through, sheriff's gonna call me up, we're gonna sit down and talk about a request for the boats, right?
It's in our capital outlay, which you will see, but we have 3 functional boats right now. So we are at.
2 of our own, 1 rented.
Right, correct. And one, they're extremely expensive to maintain. One hull repair back in 2014 was $7,500. Again, that was 10 years ago. So very expensive. To have more than 3 boats would be, I went over budget last year with the units, all of the units, the marine units. Boats are expensive and they're in the most extreme conditions. So it's not due to operator error, it's due to the extreme conditions that they operate.
So I think, the Winnie County Fire Department, and all the public, are aware of the factual situation now. And, hopefully we'll be able to address it quickly if we need to.
Yeah, the next vote is in March, has to be before March 8th, March 8th. So we should know, whether or not the direct congressional funding will occur. I've been in constant contact with the Senator's office, Senator Baldwin, and, it has passed and it's out of committee. We're waiting just for, the funding to be voted on. We all know they're, whatever they're doing at the federal government. Yeah.
And you're confident we can address any safety issues between now and the end of March or April?
Right, with the 3 boats that we have, we also have an agreement with Fond du Lac County, over the southern part of our county to help us out if needed. Yeah, I'm confident we can respond to right now, the situations that would occur on the ice. Hopefully people just take a look at the ice and it's pretty obvious, it's not safe.
And I also understand that the town of Rushford and town of Amro also have their own personal boats. For the fire departments, obviously, that could be requested for use if needed.
Yeah, you know, those are a little bit different, but yes.
Okay.
The conditions that we experienced a couple of years ago, that was extremely hazardous, so we want to make sure that the first responders are safe too, and the equipment that they're taking. That's why they're so expensive. You have a Kevlar hull, to handle damage. And those conditions.
I think that certainly clarifies it for us and the public. Thank you.
Sheriff, if it comes up and we don't have the passage of the bills yet, are you gonna be in talking to the county executive in March, April already to get them both ordered?
Right, we would want to do it, so it gives us 6 months of leeway, so they're arriving around November. Later than December. Of course, with the winters that we're experiencing now, we didn't have solid ice until 2 weeks ago. Who knows, what winter will bring, but
You and him go and talk about it, then still gotta go to the county board.
it does.
Still has to come through here. So, well, it has to, if it's gonna come through here. You just said it wasn't going to come through here.
That's not what I said. I said it's not gonna come through the bottom 50%. It would come through the top 50%. We split the spirit fund into two funds, right?
Right.
So if I'm buying boats for the sheriff, it doesn't come out of that bottom 50% government identified funds. It would come out of that administration top 50%. So just like the radios would.
Oh, so you're talking the
Yeah.
government projects.
Right, it wouldn't be in that bottom, it'd be in the top. That's if we own the boats, if there are boats, then it doesn't belong in this category, is what I'm saying.
How much is left in that top? How much?
We are-
13,400,000.
A decent amount, but we're still planning on that. We wanna attach it to the facility condition assessment and everything else. So we have projects that we're looking at administratively, what makes sense. A chip spreader and a paver for the highway department that we depend on to make income, are high priorities, for us to take a look at. So there are other things that we're looking at, as well as some of these capital improvement bubbles are coming up, so we can have a real good plan to smooth that out over time. So there's a decent amount there left, but as you saw in Paul's, Mike Elder's, facility condition assessment, we have some issues coming up. We have the rough at the jail and Parkview coming due maybe the same time roughly, and boilers. We got some big projects coming, so we are trying to make sure that we have a nice, plan to smooth that over the future.
Which would be a recommendation to the commission.
Which should be a recommendation, yeah, correct, absolutely.
So does that answer your question, Ryan? So at least you have no
My
how much.
biggest concern is that come ice rescue season for 24, 25, we're not dealing with, what are we gonna have for boats? How are we gonna deal with it? If we can say, yep, we're gonna have the boats, the two boats we need, I'm good with that.
All right.
Yes, Simon.
In the meantime, call your members of Congress and urge them to pass the budget.
Okay,
Mr. Chairman,
yes, sir.
if I might have the liberty, before we move on to a number 4, I have a question on an agenda item report that was given to us by the county exec. Can I address that prior to number 4?
Is it about number 4 or?
Well, it's general in category, and it addresses the amount of money we're going to be looking at spending today versus how much we have. I believe you have the same report. They're not numbered, so I can't. It's this one right here.
Is that the one in the veteran house?
Yes. Right. I have a question while we proceed.
Was that posted online?
It should have been.
We don't have the veterans one, it's, the number 4 is, I'm assuming you're looking at the one that was part of that packet, and that's the city of Armo.
No, that got placed in, that's something I'm preparing, but got placed in on accident.
Okay, so you don't want to address this publicly at this time?
This is agenda. Well, I mean, we've addressed in the past, and originally when I came up with ideas of what we could do, when we were talking about, let's come up with banks that people can request money for, right? And then we weren't really sure what the needs are, so we wanted to get that from the community. One of those things was veteran housing. And I had $1 million on that. This was early on in our commission.
So at this time, I'm gonna say, no, I'm not gonna let you discuss it.
Yeah.
Okay.
Well, and the reason that is, if it wasn't passed out, or if it was by mistake.
I'd be happy to talk with you offline on that. or at the next meeting.
Does this indicate then that, at this point in time, we have less than 2.6 million to address today?
That's
That's the
really hard
issue.
question to answer because we don't know until it passes county board. So how do you have a running total based off of what this committee or commission has passed versus, as we know, everything that goes to the county board doesn't always make it through.
Beth?
Yes.
So in the packet is another one of these, and on the last page, I did the calculations by grouping. So the last page has total amount of spirit recommendations and county board approved. So everything that we have recommended and the county board has approved leaves 2.6 million and some change. And right next to it is green, so that is just strictly what the county board has approved. So the county boards, for their purposes, they still have not approved 4.8 million.
Well, what are we dealing with?
So if we're looking for our purposes, I would say it's the blue category, because this is what we're recommending to spend down. Now, those recommendations, once they go to the county board, and if they are not approved, then that money would go back into that blue category for us to
Reassign.
determine, yes, reassign.
So for today's value, we're looking at 2.6 million.
Right, so the amount remaining for us to review is in that yellow, so that's the 3.4 million. So we have a difference from what is still outstanding to review as opposed to what we have available to recommend of just under 800, that's the 795. So we have about 800,000 more in requests than we have available, assuming everything would go through.
Okay, so number 7, discussion and possible action, resolution approving from the Spirit Fund Government Identified Community Project category to update water and sewer lines under the Fox River in the city of Amro, requesting $500,000. You asked me to notify them, I notified them. They bought, you want to say the brains of the group here today, or what you want to say, but all the ones that hopefully can answer all the questions that you would ask, and I couldn't, so, now's the time if you have any questions to ask. County Executive.
I was gonna say, may I ask a question before I put this on the floor? Right, so we had talked about, other funding sources, over the last week or so. There's not a bunch out there, but we did find one that there's a matching grant. Of course, there's no guarantee. And we had kind of talked about, it was, what was it, a water and wastewater as well?
Yes.
Grant and low thing that, Governor Evers had released recently. So we had talked about potentially making this amount 300,000 to be the match, and then they could get potentially get the other 300,000 from the state to give them 600,000 for the project. I would like you to at least talk about that grant, or if that's even a reality, and if it's not, I want you to be honest with me on that too.
Yeah, so the grant he's talking about, it's a grant loan program through the U.S. Department of Rural Development. It is a fairly new water wastewater treatment grant / loan program. It is for rural communities who are doing projects that we are exactly looking at here. And we do qualify for it. And we could either receive A, if the funds are available, a grant for the portion, or B, if the funds aren't available, it'd be a loan with an interest. We have to pay off, it could be up to 40 years. The requirements for it, we do meet the requirements, but there is additional requirements on top of it, which do include partnerships between local, federal, private, non-private, et cetera, that is highly encouraged. So, and with talking about this and reviewing it, what if we were to go out and procure these extra funds, which you'd have to anyway, since our request of the $500,000 would cover the full amount, as I had updated, actual costs within your packet of $685,000. We would use the ARPA funds that would be receiving as that additional requirement to procure the new funds as a partnership between the county and the city.
And then, one more question, spirit funds, just so you know.
Spirit.
Yeah. But if we are able to do this 300,000 for the spirit funds, would you be able to request more from this grant to get you to the rest of the way on this project?
They haven't truly released the funding limits and how much there was. So 300,000 would definitely go a long way as well too, yes.
I guess my question specifically, would it open the door to cover the rest of that gap of your project?
Yes, it would.
What is the total cost of your project gonna be? I'm sure it's getting bigger and bigger all the time.
As of right now, with initial costs, it's 685,000, right, Dan, on there?
685,975, so 686. That's with some contingencies and everything else in there, so hopefully we have that covered.
Can't you just bond for it and spread the cost over a number of years for your residents?
We could bond for it, however, right now, we're going through a water rate increase study for the city of Amro, so we are doing. I've already submitted a simplified rate case study, so we'd be implementing an 8% increase as of the beginning of April here coming up, and then forecasting out. And truly, the rate case hasn't been done or anything yet, but I'm forecasting on at least another 40 to 45% increase. Already having those costs incur upon my citizens, and then having to do additional above and beyond that.
What's a typical monthly rate?
Typically right now, the city has charging $2.85 for every 1,000 gallons.
So if I'm paying like $100 a month, what is it?
Yeah, what's the average?
Average, so for an average, so my bill that I had just had for 6,000 gallons is $140.
Okay. Well, water.
And if I might,
Yes.
if I understood you correct, you're looking at a projected 8% increase. And then a projected increase beyond that of up to 45%.
It would be.
For a total of 53.
So the 8% with the simplified rate case would be fully approved, that would be done. The full rate case study, so let's say it goes to 40%, it would take that 8% out of the equation, so it'd go up to 32%. So like the overall would be
About
40%, right? Anywhere from 40 to 45, I'm currently projecting for right now.
And you can't squeeze this within the 8% increase, extra revenue will be spread out over a long period of time.
The Public Service Commission's rate cases are based off of actual expenditures, so we'd have to wait for the actual expenditures to incur to do another rate case on it.
Notes? I would like to, make a motion, approving $300,000 from the Spirit Fund Government Identified Project category to update water and sewer lines into the Fox River in the city of Amro.
Want me to second it? I will. Seconded.
Motion made and seconded to approve up to $300,000. The city of Amro for, water and sewer lines under the Fox River. Any other discussion?
Yes, sir, I'd like to offer amendment. I'll move to amend that dollar amount to 343,000. Half. 50% of what they're proposing. 343.
Ask you a question?
Gotta get a second, right?
A second.
Okay, seconded. Discussion.
So, the idea is that allow them to ask for the other grant to get them all the way there, correct?
Yes, and I think they're gonna come back with a half situation, right? That's what I'm suspecting, so that would cover about half of what they're suggesting.
I can take it as a friendly amendment then?
We got a second, motion made and
Okay.
seconded already.
All right.
So, any other discussion?
343,
Any other discussion? Any other discussion on the amendment only? All those in favor signify by saying aye. Opposed, say nay. That is carried.
Thank you.
Now we'll go back to
The amendment.
Yeah. Now we'll go back to the original motion. It'll be for approving of 343 for the Spirit Fund Government Identified Community Project category to update water and sewer lines under Fox River in the city of Armo of $343. $343,000.
Recommends a grant to change it on line 11.
And what?
So.
Change the resolution.
Right.
Oh,
So you're gonna put $343,000,
$43, right? $343,000, right?
yeah.
Yeah.
So I know you're,
This is just a draft, so our,
this is just a draft, but we wanna make it
okay.
accurate.
Right,
Right.
right.
And then you do line 10, you line 11.
Well, no, line 10 said, City of Amro requested 500,000, and that was the original request.
Right.
But the change is,
Change is 343, right?
Strike it and put in.
Not the request, because the request is 500, just the other line.
on line 11, because they initially requested 500, okay? 343?
Yes.
All set on
Keep
that?
this?
Nope. All right, hearing that, roll call.
Egan,
Aye.
Damo,
Aye.
Cox,
Aye.
Barry,
Aye.
Porter,
Yep.
Belter,
Aye.
Oswald,
Aye.
Galloway,
Aye.
Thank you so much. Thank you. Thank you all.
Good luck.
What's that, by 8? Anything else? Is that
Yeah.
7?
We'll do
7 or 8?
that's it.
8.
Did you hear before, I know, did you hear anything from Supervisor Eisen?
I got an email saying that, he was gonna listen to the rest of the meeting, but he felt that, Supervisor Farley and Cox knew how he was feeling on certain issues, so. So he was not gonna speak.
We discussed that with Beth as well, so there's some changes on that.
Okay. All right, number 8, discussion possible action, resolution approving blank from the Spirit Fund Government Identified Community Project category to expand building of Nova and counseling services facilities.
Yep. Nope.
Executive.
Like to make a motion, approving $500,000 from the Spirit Fund Government Identified Community Projects category to expand the building of Nova Counseling Service Facilities.
Second. Motion made, and seconded, discussion.
Question. This 500,000 since it already came through this commission, was it already included in that 2.5 million?
Yeah,
To Supervisor Fari's point, I don't
Yeah.
yes, it is.
want to know where
It's
it
included.
is.
I think we're getting,
It is included in that.
Supervisor Farley.
obviously, I think we're getting into a situation where we need to prioritize some of these requests. And I'm not sure we're gonna have enough money to do all.
There was a question of Supervisor Eisen, which brought up a tax situation. I don't know how many of you seen that or whatever, but he was questioning that their taxes, they even, usually for taxes and if they're even a 501(c). So I don't know if they did, if you see that, Beth, or not.
So I listened, I watched the recording and I listened and I wrote down exactly what the supervisor said, and his concern was on Schedule O of their tax return that stated that they don't make their financials public. And it also states that they don't have a conflict of interest policy on file. So nonprofits are required to make their financials public, and the way that he could read Schedule O is by viewing the financials, so I'm not exactly sure what the challenge was, because he had the financials from a public website. So it's probably a matter of semantics that they don't publish their financials on their website or in their annual report. But clearly their 990s are listed and they're complete with the IRS. So I wasn't exactly sure where the confusion was. Then as far as the lack of the conflict of interest, their revenue has really always been through insurance reimbursements and county contracts. So Winnebago County has been contracting with them for 30 plus years. And the lack of a conflict of interest has not come up as an audit note on their third-party audit, and clearly the county hasn't had an issue with it for 30 years. So again, I wasn't exactly sure what the challenge was, since they've been contracting with the county for so long, and the county's clearly reviewed their financials for 30 plus years, and their financials are made public.
Corporation Counsel?
Basically, I was provided some information, and I see on, the tax returns were filed, but the tax return does say, at least question 19, describing Schedule O, whether the organization made its governing documents, conflict of interest policy, and financial statements available to the public during the tax year. So then, as that Oswald referenced, you go to Schedule O, and this is the supplemental information, and there was one line that says, this organization does not make its governing documents or financial statements available to the public. The organization does not have a conflict of interest policy. That's on the supplement, but what Oswald says, there's other areas where you can find the information. So be it, but I'm not aware of that. I just know that based on this, I think that's what Supervisor Eisen's concern is.
Was not being able to view the financials?
Yes, and based on what was in the actual,
Schedule.
return, the return.
The 990.
But you-
Executive. A couple of issues I want to address on this is, number one, we have had talks with their executive director. They are gonna go to the board and do a conflict of interest policy, I believe is what they said. They just have to do that through the board. We had no issues with that. We've never had, as a county, have ever had any issues getting documents or what we need from them. So there's nothing that we see or that Director Copel sees as being any area of concern from where we stand on that. That being said, the project itself, I just want to explain a little bit more. This is the only treatment facility we have in Winnebago County. And what this will do is help fund, not fully fund, but help fund their ability to have women in treatment again. So since COVID, they haven't been able to do that. They've kind of separated the quarters. So this is gonna allow, right now it's just male, and now it'll be female as well in treatment. The amount of money that we save for everybody that we put to treatment in Winnebago County that Bill can contract versus somebody has to go out of county is significant. So this is very much not just in the best interest of our citizens seeking help and treatment, but also in the best interest of our bottom line going forward with human services. And I just want to stress that. Bill, I did ask Bill Topel, Director Topel, to reach out and have a significant conversation with Nova, and they will be at the county board if it goes through.
That was what I was told.
Right. So those are the only points I wanted. I'll be in support of sending this back.
Supervisor Cox, did you have something?
I wondered if this wasn't something that we should ask them to present at the county board. Ask the noble people to come in and present it to the county board to help initially to get it over, over the hill as far as the votes and whatever. Is there going to be people that look at what they could get off of the IRS information and the 990, and if they haven't read it properly, or if they can't read it properly or whatever, it still can be, steep hill to climb when it comes to voting and whatever. And I think a presentation would be in order for this one. I mean, it's one of the biggies out there that are taking a good deal of money and expecting to build.
Chairman Parry.
I have a little different perspective. I guess my perspective would be a deal more with expectations. We have a nonprofit requesting a large amount of funding. And when we have a supervisor that has the ability to start looking into the background for this nonprofit and discovers discrepancies, I'll use that term, and points them out, now we have Nova responding and saying, okay, well, we'll do this or we'll do that. Why haven't they done it in the first place? I mean, that, to me, that's a concern. When I look at nonprofits, I look at funding, I look at total transparency. It should be there for everyone. So them to respond and say, okay, well, we'll do at least part of it. To me, it just don't add up. So I don't think I can support it, frankly.
Beth?
So my response to that is the only way to see the Schedule O is through the financials. So the financials are out there. He was incorrect. The supervisor was incorrect when he said their financials are not made public. That's 100% false. They're out on GuideStar. Their 990s are up to date. Everything has been filed. He was confused. He was incorrect.
I'm not sure I heard that response from Marianne. Am I incorrect, Marianne?
Can I just look at what, that Oswald is?
Sure. It's the 990s, which is the income tax. Basically, it's a tax return, but because it's a nonprofit, it's just a tax filing.
Right.
But
can we go to line 19?
Which year are you looking at? Is
In
that
21?
Okay, this is.
And
the
I'm sure
22.
maybe it's just in a different spot.
No, here is, well, this is a different organization, but let me pull
Well,
up.
let's go.
Yep,
Yeah.
I'll pull up. What I'm guessing
Right.
is, where he found this, because it's a public free.
It's a public document. So if it's
Well,
in
this is
another
a public
spot.
site,
Okay.
and this would be the only place really to access 990s and financials is through this. It's called GuideStar, Candid. Nova Counseling, so you can look at their 990s.
Okay. I actually need, yeah. the
So the
schedule.
2020, so there's the
2021.
21.
Okay, so let's go to line,
So you can
19.
see contributions,
Right.
revenue, other revenue, total revenue,
it has it all
grants,
down. And then if you go to 19,
expenses.
no, I'm sorry, it's under section C disclosure.
Installation.
No, I think you might have passed it. It is, I believe,
You have an ID number.
Section C, disclosure,
That's it.
describe
And
and
go to
schedule
19.
O.
Right, and if so, how that's exactly how the organization made its governing documents, conflict of interest policy, and financial statements available to the public during the tax year, okay, so that's that. So then you go to Schedule O.
Which is at the bottom, you have to scroll through all the
Yeah,
financials.
I understand, but at least the financials are there, but unfortunately, under Schedule O, there was a statement
Right,
that
and
said, as you can see.
they don't make them,
This
Open.
organization does not make its governing documents, financial statements available to the public. The organization doesn't have a conflict of interest policy, though above it, as you said, there are a lot of numbers. But
Right.
unfortunately, I
So-
think that's where that supervisor,
But that's
Was looking-
contradicting what that just told me.
no, what
You
this is,
said the financial are available.
they are, so what they're saying is they don't post on their website publicly. They don't mail out their financials in an annual report. They just don't do that publicly, but they're accessed. They are filed with the government and the
If
government,
you have that computer program to access
No.
them.
it is a
like
public
CCAP.
open source website that anybody can access.
And their financials are on there.
They're all on there.
Well, why is that statement in there then?
Because they're saying, we don't do this on our website, we as an organization don't post it.
But
on
you're
our
saying
website.
they do have it on the website.
The organization doesn't, the IRS makes sure that these are all public.
and we just looked at the EIN number.
Paul? I just did a Google search on Nova Counseling Services and came up with the same EIN number 39-117-2266. It comes up as nonprofit Explorer Wisconsin, some company called Pro Republica that has financial statements and schedules from 2022 all the way back to 2001 on their site.
So perhaps they.
So
use-
they don't publish it to the public, but they have to file them. So then they're
transparency.
available for, you can get them, basically is what I'm saying. They will not, if you ask them as a person, they will give them to you.
They
But
But they're not
obviously they're-
transparent.
They will, but they obviously sell them or some other people can get them.
So my concern.
What was the name of the Google?
PROPUBLICA.
Yeah, if you
It's
go to,
also on IRS.gov too.
so their
Just on the-
financials are public, they just don't actively make sure that they're updated on their website. That's extra manual work. A lot of nonprofits don't do that because keeping the website up to date with financials and all of that takes a dedicated person. And then as far as the conflict of interest, I mean, that again is public. They're very open about that. The reason that they didn't have it is nobody's brought it up as an issue. The third party auditor, nobody's brought it up that they had to do that or that they were required. And now that it's been brought up, I talked with Jody and she said they're sure, we don't have an issue, so they're bringing it to their board to develop one or design one.
Yeah, I think I addressed that in my comments. Thank you.
Any other discussion? Just want to clarify if I could, from what we have seen, there has been no discrepancies on their taxes. Just want to counter that a little bit. So maybe a little bit complicated to find. And again, I understand, I respect Supervisor Eisen very much so. I agree to
summarize. You know, it's unfortunate that we have to dig into this and get this kind of stuff, because my expectations are, hey, you're a nonprofit, everything, what revenue, receipts, expenditures, how much you're paying your director, all these things should be there for anybody, transparent. They shouldn't have to get a separate computer software program. They shouldn't have to do any, it should be there. So that's my concerns, and it's gonna be my concerns with all of these. I hope they all comply and help the public understand what they're doing, what they've spent, and why they're asking for more money from this commission. It's just a very general statement.
It is easier to access them publicly than to try to figure out who's the director, reach out to the director, have the director be pulled away from the work that they're doing to look through their files to find the most accurate 990, to scan them in, to email them to you. And then 3 years worth is probably 150 pages. It is much easier to go on GuideStar. So when I and my group were looking, we didn't even ask them for 990s. We went to GuideStar immediately. You can find the last 3+ years of, from most of them. Now, the organizations that bring in less than 250 of revenue don't have to file a full 990. There's a postcard, but it is exponentially easier to just go on the site and review them that way rather than trying to get them from the organization. So, and that's the IRS filing, so we know it's the most accurate.
I understand that.
County Executive Dale, with your hand.
I got nothing further to say.
Okay. Any other discussion?
I'm frustrated that this made Nova Counseling look like they were doing something inappropriate. The Herald published it without doing their own research. I think it's gross that this is casting a shadow on the work that Nova is doing. I think it was things I can't continue on talking about.
Well said. Okay, motion's been made and seconded to approving of $500,000 from the Spirit Fund Government Identified Community Project category to expand the building for Nova Counseling Service Facilities. Any other discussion? Roll call.
Egan,
Aye.
Demo,
Aye.
Cox,
Aye.
Barry,
Abstain.
Porter,
Aye.
Belter,
Aye.
Oswald,
Aye.
Galloway.
Aye. Number 9, discussion and possible action approving from the Spirit Fund Government Identified Community Projects Category 4. One at a time, or you want to? Or you want to do it, guys? One at a time?
One at a time.
Okay. You by chance know how much money's left now?
Sure, yep. Well, Nova was in that number,
Okay.
so, wait, let me. 343 was the city of Amro.
Get your thing up here so I can look at it.
Yeah.
So we have 2.2 million and some change left. Because I put Amro 343, oh,
We reduced the Amaro one.
She got that figured down.
It's figured down.
oh, wait, I'm sorry, I put it in the Nina, yep, you've got it in Amro, yeah, so it's at 2.60. Is that what, 304, I can't read that.
23047.
Okay. 2.304743.
Okay, the first one up is People Progression Incorporated requesting $50,000.
Thanks, Mr. Chairman. I'll stick my neck out. I'm very concerned about the funding is just for a particular race. And frankly, I'll have nothing to do with that. I'll not support this. I consider it to be discriminatory.
Not open enough for either one of us.
Somebody want to make a motion so we can get it on the board?
I'll move to deny.
Second.
Motion made and seconded to deny People of Progression in Corp for the request of $50,000. Any other discussion?
My issue with this is, it's not their property. It may be their property sometime. I'm not comfortable with remod in another landlord's space.
personally. That's my issue with this.
Any other discussion? Any other discussion? Roll call? This would be for a no.
So
All right. so
vote
we-
yes for no, right?
The motion is to deny. I support the
Motion is
motion.
denied, right?
Egan?
No, or deny, however you want to put it.
Yes, right?
Aye, yeah.
Tonight.
Aye.
Yes.
Aye.
Damo?
Deny it.
Cox?
Aye.
Barry?
Aye.
Orchard?
Aye.
Belter?
Aye.
Oswald?
Aye.
Galloway?
Aye.
New mental health connection requesting $90,000.
I would like to make a motion to approve new mental health connection for $75,000 was the amount?
Yes.
Which is their amended request, I believe.
Correct.
Yeah.
I'll second.
Motion made and seconded with 75,000. Any discussion? Any discussion? Any discussion? Roll call?
This is for 75.
This is for 75,000.
Yes.
Egan?
Aye.
Damo?
Aye.
Cox?
Aye.
Barry?
Aye.
Orchard?
Aye.
Belter?
Aye.
Oswald?
Aye.
Galloway?
Aye.
First five Fox Valley Incorporated request for 300,000.
Mr. Chairman, I'll move to lay that over at the request of the health director. Am I correct? No.
Human service.
Okay, health service, excuse me. That was a suggestion. I was, wrong guy, that's Doug Garrett.
Is there a second to lay this over? Second. Motion made and second to lay first five Fox Valley Incorporated over. Any discussion?
Layover specific to, you want next board meeting or you want?
Date certain.
Motion.
Date certain. That would be. Well, can we just say the next commission meeting? Just
Okay, next commission meeting.
That's 2 weeks, yeah, well, we'll see, I wanna fight that later, cause this has been crazy pace, we're drowning trying to keep up.
Would you prefer the commission meeting in,
March?
Let's just do the commission meeting. Let's not jump
Yep.
meetings right now.
Yep. What's the next commission meeting?
in March?
In March, can we lay it over to March, can we do that?
Next meeting is in February. February 22nd, or no.
Director
not my
Cole said
motion.
he wants a month. Is what he's requesting.
Yes, that's what I'm saying. The next commission meeting, my motion is to lay over to the next commission meeting scheduled for March.
Postponement to date certain in March and give them a date.
Motion.
I don't have a date certain in March.
Motion is to lay over until the next meeting in March, first meeting in March.
Right.
And
Seconded.
That's been seconded. Any other discussion? All those in favor signify by saying aye.
Aye.
Opposed, say nay. Carried. Tri-County Community Dental Clinic, request $403,625.
I would like to make a motion to approve the Tri-County Community Dental Clinic and Incorporated request for $403,625.
Second, with pleasure.
That's seconded. Discussion. I'll definitely support this, but my only thing is, of course, it's gotta come out of our area. But it should be like Winnebago, Armro, and all the other schools and this and that.
Yeah,
I really think that they should so. But they definitely have need some help out there, so. Yes, sir.
I would give direction to our department heads to help coordinate how we can make that happen. So we can make sure that we have the population out there to make it make sense. I appreciate your willingness to do so, because it's very important to us as well.
Allow the commission to come to their clinic.
Any other discussion? Roll call.
Egan.
Aye.
Damo.
Aye.
Cox,
Aye.
Barry,
Aye.
Borcher.
Aye.
Belter,
Aye.
Oswald,
Aye.
Galloway.
Aye.
Childcare resource and referral, request of $450,000.
Can I just pause for a second to just make sure that our math, we're adding up? I just want to make sure. Apologies for that.
Oh, Jesus.
Okay, 1 point. Yeah. So you're 14.5. 14.8. Right? Oh, 350.
You're changing the numbers on there, yeah.
1.826, okay. So that's, our numbers agree. So right now, we have 1.826. 1.826,118 remaining.
Say that again, please, Beth.
Yes, 1.826,118. So the total approved by the board and the commission right now is 14,868,882. Right? I cannot read you those.
Okay, so we're up to the childcare resource and referral request. $450,000. We should have a motion, at least get it on the table, then discussion.
That's, wait a minute, that's a crossover to the YMCA request. Well, I wanted to get there, but it ain't on the floor. Somebody else put it out there.
And all this funding will go to Winnebago County programs, even though there are 5 counties. They serve.
I'll make a motion for discussion, a motion to approve the child care resource and referral. Request for 450,000.
For discussion only? Are you?
Well, you gotta get it on for
Looking
discussion.
for up or down vote today.
I'll second it.
Motion made and seconded. Now discussion.
Mr. Chairman, thank you. My review of this is, and I understand what they do and what service they provide. However, as I go through the list provided by Paul, we have 500,000 that was approved to the YMCA child care expansion. To me, that is a very worthy, viable thing to do, to increase their child care services. That is on hold. We approved it and it hasn't gone to the county board. It's on hold. Why is it on hold?
Do you want me to address that, or is that a separate thing?
Because
Don't look at me, I know.
Well, all right,
we basically have a duplication. I'm of the opinion that YMCA has their own
I will,
ability to cover absentee and all
I guess what in respect to YMCA right now, I just wanna, say that they've requested to bring it back and pause it. They had something to work on their own project. I don't know what they've had public, it was on their request, to bring it back, and to put it on hold. There may be a change of where they're going to do it. It's still a childcare center. It's still, going to do what we want it to do. Where they put it might change. So they requested that we pause it. I think that's about, Beth, did they say what they're willing to talk about?
So there are some other opportunities for an existing childcare center that they could purchase, which would be less expensive than the rebuild that they were requesting, which is why they asked to put it on pause, because they're looking at another location within Winnebago County, not specific to Oshkosh, which would expand their reach. So, I mean, it's yeah, it is a good thing. So they just didn't want 500,000 for the expansion to be approved, and now they had to come back and say, hey, we're not expanding to that level, we want to purchase. So they're trying to be open about what's happening, so.
Sure, I appreciate that.
Sure, they've been working on it for a few months, and they hope to have something by the end of February, so that it could move forward. So the YMCA is a center.
My question, that 500 is still on this, right?
Cassie, can you go up? I did not add it.
That's item 5 or 6 rather on your.
Because it did pass here.
Yeah, can you keep going up? There. So I did not put it in that pass or recommend. I left that blank because they don't know, they realized that they would only ask for half.
All right, so if we put that 500 back in there, and if they only come back and it ends up being 250,
Right,
that's coming out of this 18.
it is.
All right.
Correct.
My
So
other,
that's why I yellowed that. to
Oh, you
make
haven't
sure.
taken the 5 off of them, so.
I have
Right.
not,
correct.
right.
So we actually have less.
Well, maybe. My other question to you is another resolution for 500,000 got passed through this and then got withdrawn before it got to the board. Has that been added back to this total?
Yes, so then if you see request from Damascus Road Project,
Mhm.
that was a $500,000 request that was approved here, but we held it to go before the board because they asked to withdraw their application. So that money is back in the pool.
Okay, so this 1826-118 is not accounting for whatever the YMCA may have.
Correct.
And already has subtracted the 500,000.
Correct.
Okay.
So if you want to hold 500, that would bring the total down to 1.3.
John, all right.
Probably should, yeah.
I wanna talk on this agenda item itself.
Did Damascus drop its project altogether?
They did.
Yeah, okay, all right. So,
Mhm.
John? All right, I think the work here, is great. My issues with this is, it's more of a program, and it's more of a Band-Aid. I agree, that somebody's thinking about, we need to have this thing to go plug and play for, childcare personnel who are short. I wish I had one, for the restaurant industry. I'll tell you that much. That would be great. But it's not, for me, it's not enough of solving the issue of training childcare or figuring out how to get the childcare open or licensing people. It's literally a life raft, which may be wonderful, and it sounds like something, if it wasn't through this purpose, that I would be all for. That I struggle that we're plugging a gap and putting a Band-Aid instead of solving a problem and what we could do on that. So just one second. So I think I struggle on this project, not because of the merits of the work. Just because it feels like we're gonna be putting $450,000 on as a Band-Aid, and I don't know where I'm gonna land on this one. Still, I fight on this one in my head. Cause it's a lot of money for supporting an industry that needs the help, but it's by no means a solution. And by no means, I guess, a legacy. This is a short-term fix, which I think we all discussed that we're not gonna do. Or a program which we all discussed we're not gonna do.
Supervisor Cox, let me help you there. It's like the Uber, or it's like a transportation thing that comes up in place of busing and taxis, whatever. It's like a connection for all different parts of the industry to be able to connect up between the individual child, put them here and put them there, or whatever else. We're missing the important thing, and that's setting up either the physical building or the various childcare centers in the area or in, say, Oshkosh or in Menasha or whatever, and then being able to go to them. But I think this is more a connection program between various basic needs for the children. This is not first five. So this is
Right.
This is another type of a resource or referral to various care centers or various daycare centers, is it not?
I don't, that's not how I understand it. May I ask our health director to explain if this, Doug, is this to have trained personnel to go where people are short? Or is this to actually train new childcare? Is it to plug a gap or is it to actually build
Which project are you on right
on,
Childcare.
childcare?
Childcare resource and referral?
Right.
Yeah, so this is, childcare resource and referral can help develop capacity within the community, by, educating, expanding, childcare options within the community. So this is a way to help provide support for, in-home daycares, other unlicensed
Is that
daycares.
what this is? What is this 450 specific?
Are you familiar with it, Doug?
I'm vaguely familiar with it, and I know the channel I connect on.
It sounds to me
So this,
like,
In its first.
Mhm.
I'm sorry, I.
So it provides, supports childcare providers with training and mentoring. And so there's lots of opportunities for childcare that exists within the community that it's untapped today that isn't realized. Anyone that is, that already does.
But this is, so the specific ask is to help, so they started, as Candy talked about in the public comment, they started this program or project where they hired a pool of, trained childcare providers because local daycares were finding that they had to shut down rooms because the only daycare teacher is sick. So now they had to shut a room down. Now all these 8 kids have to stay home or parents have to find other options. So they would have paid staff go in, substitute, teach, kind of like CC6 does in this area. So then the daycare can stay open, the parents can have their kids come to the daycare. So YMCA is talking about providing the space and CCRNR is looking for funding for a pool to expand this program into Winnebago County. So there would be a substitute teacher pool, and they're finding that in childcare centers, because they're short-staffed, like restaurants and everyone else is, that they're just hiring untrained Tom to watch kids. No offense, Tom. But, so they would then go into daycare centers and provide training because the center can't afford to have Tom take off time to go get trained. So now he's there and that's what the funding specifically is for. So over the course of a 3-year period.
Supervisor Cox?
It requires, as teachers are required to have a licensure, so are daycare center
The
people.
center is.
To have training and have licensure.
Mhm.
It's like having a pediatric nurse or a practitioner run from house to house to house or whatever. These licensed people, after they were trained, are now able to go into a daycare center and run the daycare center when they can't find enough, or
Mhm.
they can't find enough help.
So daycare centers are it's probably not appropriate. The only thing I can think of is bartending. There only has to be a licensed bartender, so Tom can bartend without his license as long as a licensed bartender is there. So he doesn't have to have the training. He can work there and he can probably do a great job, but they want to make sure that the untrained, uncertified, licensed individual staff people also get trained.
Supervisor Borchert?
Is this a people issue or a system issue?
Yeah.
It's both. I guess to just depend on what's been said so far. We can expand the capacity of childcare in Winnebago County through CCNR. As I was mentioning before, we have licensed and we have unlicensed, childcare. CCNR can help expand the unlicensed childcare within our county. So in other words, if let's say I'm a stay-at-home dad and I'm watching two kids at home, CCRNR can help me be ready to take on additional kids into my home. And so they can help with safety issues and food issues and training issues. And that you can just expand the capacity of existing unlicensed daycares through them. So it increases capacity. And they've done this in other counties. They have not done it in Winnebago because there's been a resource lacking. And so this will help expand access to childcare through training and, assisting, people that are already taking care of children to be able to take care of more.
So I still don't understand, is it a people issue or is it a spreadsheet issue? Where you're trying to organize, because right now there's a shortage of people, right? Is this gonna get more people?
It will, it may be more attractive for somebody to stay home if they know they can take care of their kids and three more. Yeah, as opposed to just having to decide whether they're gonna work or stay home and watch two kids. If they could stay home and watch 5 kids instead, then it might be an easier decision. That expands access for childcare and puts somebody else to work that might otherwise not.
It's both.
Executive. I mean, I get it. If a donut shop doesn't open, no big deal. But if a childcare center can't open, that's a big deal for a whole bunch of people in the workforce. So I do understand that. Am I allowed to ask Candy Hall, and I think she's the one that works for the Resource Center. And yeah, she's on, and I want to ask if this would actually, are we training people? Are we increasing people qualified to do this with this, or are we just plugging holes? Number one, and number two, what if it was 250,000? Could you do it off of that? Or how much could you do? So those two things, if I'm allowed to ask her.
Candy Hall on Zoom.
Yep, I'm here.
You're here to-
To the first question, we're doing both. We're plugging holes, but the substitutes that we're sending into the programs are very well trained. They're people who have been in the field a really long time and they're really well trained. And as somebody had stated before, getting a new teacher out for training is a little harder because they're already putting in a lot of hours. So what our subs are doing is when they're in working with the staff, they are mentoring. They're having the conversations about best practice and how to rearrange a classroom to be the best place for children to be, things like that. The things we typically do out of our office, they're able to do on a one-on-one basis as a substitute in the program. They also support the directors when the directors have questions. Where do we find resources, things like that. So yes, it is plugging a hole, but it's also building capacity because one, I'm not going to continue working for a childcare center if every time my child is sick, they tell me I have to bring my child in because they don't have anybody to replace me. What am I going to do? I'm going to leave the field because my family is important to me. And there's where these directors are really struggling because when somebody calls in sick, they don't have an option. I mean, many times these teachers are told you have to come in, or I scheduled a vacation, you can't take it. I don't have anybody to replace you. So it builds capacity kind of the other way as well, because having somebody there to say, give a teacher 6 weeks off for maternity leave rather than 4 weeks, which is what we typically see in this field, giving them 6 weeks off and having a consistent sub in the classroom will retain people in the field. So I hope that kind of answers the question there. And like you said, there's no one thing that's going to fix the childcare crisis. There's just not. And as for the lesser of the money, yes, we could. We can definitely work with whatever, the committee is willing to give. It might mean less subs, it might mean shorter than the, right now in Outagamie County, we have 3 subs. And that amount of money would get us about 2.5 years in Outagamie County. So I would assume that we could probably, might not be able to do it for the full 3 years, but we can definitely do it for less money. It would not change the qualified staff that we put in the programs to help them with best practice and just do better.
Vice Chairman Fari?
Thank you, Mr. Chairman. Follow up, then you are the employer of these people. The funding you're gonna receive actually supports their employment. Is that correct?
Yes, we do employ them, yes. And the funding would support them.
Jim Galloway?
I don't care if it's a Band-Aid or if it's a systemic issue, these are kids. They're our most important asset. If we don't support them, if we don't support the families, because we don't have health care, we're doing a real disservice to our community. So if the government, starting at the feds to the states, is not taking care of the issue now, if we can buy 3 years of help, to me, it's worth it.
On exec?
I think that's my point and why I'm bringing up the 250. What she said that she has some data off of Outagamie. If 250 buys us enough to get data to see what effect that 250 can do, this is something we need to find out how to do. To Tom's problem, is this systemic? Or is it people? Well, if there's a systems failure here, we gotta figure that out. I think 250, I think I could support enough to get us the data to see, because you're right, we gotta do something, but not just a spirit fund and then we're done. That's why nobody wanna do programs here, because then what happens when it's done? So to be very clear, the 250, I would be willing to support, and I'll probably make an amendment on that, just to get them the data to see where this is, and then it's on us to figure out how we fund it and how do we go about it and how do we get that systems figured out? How do we bring that training to these people? How do we get them licensed and how do we actually start making some solutions? So with that, I'm gonna make an amendment to go to $250,000 on my original.
Is there a second? Is there a second?
I'll second it for discussion.
And a second discussion, Morris?
How sustainable is this kind of a business? How does it rest over a period of time? It's hire a nurse, or it's hire a practitioner, or hire whatever. But it is a manpower or a man-woman or a woman power type thing to continue to operate these childcare centers. And yes, it's a good idea, but do they have a sustainable pattern of work going on for what they're doing here?
Supervisor Fari.
Thank you, Mr. Chairman. Your point is data. I heard her say that they could use a Door County example and Outagamie for 3 people, 250 would employ 3 people. Is that correct?
3 years.
Is that right, Candy? 3 people in
That is
Outagamie?
correct.
Yes.
Okay,
3
so in
people?
other words,
Yeah.
we're talking about not really data, we're talking about how many people we're going to fund. If we appropriate 450, it's more people, 250 is less. Is that correct?
Yeah.
Okay.
The data I'm looking for is that if we fund these, because right now, it's not sustainable. Childcare nowhere, no model is sustainable right now. And it's all falling apart at the seams, unless you have other funding to support it. If it's a stop loss, right? So people can do that. The data I'm looking for is if we fund this for 3 years, because people are, it's getting stressful. The data I wanna know is how many people can get licensed? How many daycares need to take advantage of this? How many places have we gone? Have we remained open to buy us time to figure out some of those systemic issues of how do we get the training done? How do we make it more accessible? Right now, it's struggling. I don't think I can support it at $450,000. I think I'm willing to support it at $250,000, hence the amendment. I think that's enough for me that I've talked to enough of people in daycare right now, that are struggling to keep it going, one in Amro, right? That's struggling to keep it going because they don't have people to do it. So their only decision is to shut down. And that puts all these other people in jeopardy, and this would buy us time to figure out a more sustainable solution, to Tom's point, to get after some of those systems issues. And meanwhile, to Tim's point, not letting all these kids suffer while we try to figure it out. Does that answer your question?
Is 3 people enough? That's the question.
No, let's look at the business model before you start adding people or taking people away. Let's find out what kind of a business model we're throwing money at. Before we, that's what we really need from her, is what is the business model?
You can ask her, she's doing it out of game right now.
So Candy and I have had those conversations. What's the sustainability? Because we don't want to just hire 3 people and after 3 years, now where's the money? So they're looking at a model that it would be pay for. So if you want to be part of the availability of a substitute teacher, you'd have a fee or a membership fee type of thing. Now that's gonna work better probably for bigger daycare centers, but they've already polled some individual providers that said if there was some kind of offset fee that you'd have to pay, because still my in-home daycare can at least remain open if I have to be gone for the day. So daycare providers have already expressed that they would pay for a service. They just can't afford to hire somebody at full cost. So the sustainability, their hope is, so that's the data that John is probably talking about. How many do we need? And then Alana passed out this resolution, and this is the resolution that I was referring to in my, the document that I included, that in 2019, there was carried by vote, really a resolution to put forth actions to help resolve the early child care issue and take care of young families. So, I mean, this is 5 years ago. This is the perfect type of free money that we've been talking about. What do we do? Well, you can follow whoever was here in 2019 and voted on this. This is what's going to catapult this work now.
John, I want to amend that you just put up, say amend it to 350, not the full quote, not the lesser 250, but the 350, and see how they work with it then. If the model is there, if she is running a good business, she should be able to extend it out.
Well, we have amendment on the floor here first, so.
That amendment was for 250.
Right.
I'll withdraw my second.
So it's withdrawn, so now back to full back.
Now you're back to 450.
Right,
That's
so
what we
now
again.
you can do what you want with it if you want. Tom?
I'm still having trouble here because I envision it as being 2 problems. Number one, the problem is temporary relief for existing daycare providers. The second problem is there isn't enough of those to begin with. So by doing this, are we helping ourselves in the big picture, or are we perpetuating where all of a sudden after the 400 or whatever it is done, they're coming back and saying, now Colony, we need this much, something like radios, I guess.
Yeah.
It's a matter of expanding that business to get it down here into one.
So a portion of the funding would also go to training. And the intent would be that staff now are trained and feel more apt to be able to stay in the position. So that is what the hope is, that instead of a churn of daycare providers just leaving and it's a quick fix for a job for somebody until they burn out, but they would stay and then it'd be a more sustainable childcare center because staff are staying longer.
John?
I will say this, after meeting with Candy, sitting down across the table for her and seeing her passion and the bags in her eyes because she's tired. She's somebody who's trying to figure out solutions. And if there's anybody who's really trying to figure out solutions and throw anything against the wall to see what sticks to actually just at least stop the bleeding in this industry because it's getting rough. It's more Candy is really what sold me. I was originally, I think when this came across the desk, it was programmatic and I was completely done with it. Absolutely not. But the more I talked to her and what we're trying to do this to figure it out and get in so that people can actually leave to train, because right now you can find somebody willing to train, but they can't leave to go train. Because they need them at the place. So
Are we paying them enough?
that's not our problem. That's not our industry, right? So, and I don't know what they're doing. All I know is the regulations, and there doesn't seem to be a single model that's working. Whether it's facilities, whether it's at home, whether it's whatever it is, it's all brutal. And they're really trying to find solutions and. No, that's why the 250 okay was a right for me to get there. But to answer your point, if we're gonna get data that's actually gonna give us a direction to steer to figure it out, I think the Child Care Resource Referral Center is the partner that's gonna help us figure that out.
Tom Belter?
Let me weigh in here. I financed 3 daycares over my career, all 3 of them went out of business. I was also on the YMCA board when our daycare was gushing money, but we figured out how to take donations in and bring it up to break even and actually expand. As we know, the federal subsidy expires in June, I think it is, so daycares will be even more challenged. The state's working on it, Wisconsin Economic Development Corp's working on it. There's a Northeast Wisconsin Coalition of Economic Development people that are working on it. Normally I vote this down because it's salaries, but with everybody acknowledging the problem, the industry doesn't work because you can't pay the people enough to charge the users enough to allow it to be affordable to pay $250 a week for your child. But there has to be a solution. I think it'll be resolved in the next 2 to 3 years, and this will get us to that 2 to 3 years. Help us get there. So I'll support it, but reluctantly because it's paying salaries, and that's what we said we weren't going to do with our spirit money. But I'll support it.
Can I give a mathematical update? Would that make you feel better if I play with numbers and give you scenarios?
Yeah, we're gonna be down to 800,000.
So if I just plugged in, if I plug in 500 back to the YMCA, 300,000 for first 5. These are just theoretical. YMCA of the Fox Cities, 500,000. I don't know what's happening there. CCNR at 350,000 and Pillars at 50,000. Let's assume we just all vote yes to everything. I'm sorry, what did I say?
You put it at 500 on the right.
Oh, that still leaves us with $126,000 available to allocate.
Plus interest?
Plus interest, but I mean, it's,
That's that with John at 250?
That's not with my,
that was
veteran
at
housing, I'll tell you that.
350.
It was at 350 that I.
Yeah, yes. So, right, if there's housing, but I know there's the concern, like, we're gonna run out of money, so I just wanna give a gut check on where we're at with funding. Now, YMCA Oshkosh could come back lower. Things could not pass in the board. But just wanna make sure everybody understands where we are financially.
You didn't make a motion for 350 yet.
I make a motion for 350.
Amended, okay.
An amended motion to approve for only 350.
I'll second.
Your second, just leave it at that.
Second came from John, so that's the compromise, right?
A motion is made and second for the child care resource and referral to go to $350,000.
I missed the motion or who motioned it.
Motion
Morris.
seconded
By,
for 350, John, second.
John.
Any other discussion on that? Any discussion? All in favor of the amendment signify by saying aye.
Aye.
Opposed, say nay. Now, on the original motion, $350,000 for child care resource and referral. Well, I better vote on it. Roll call.
Egan,
Aye.
Damo,
Aye.
Cox,
Aye.
Barry,
Aye.
Borchert,
Aye.
Belter.
Aye.
Oswald,
Aye.
Galloway.
Aye.
Pillars Incorporated requests $50,000.
Make a motion to approve, Pillars Incorporated request for $50,000.
Second.
Motion made and seconded. Discussion.
If I can share, I did talk to Lisa Strandberg, who's the executive director there. Obviously, this is for the housing. It's 38 people total, all Winnebago County. These are youth in the system, homeless that have now aged out. So they're living there. We were impressed that they're looking at a different model because they are housing people, and right now they're offering mental health and all these other services. So now they've had a couple different conversations with other organizations that offer those specialized services to have them come in and do the work. So some of those expenses come off of Pillars. So they're really trying to think of their long-term sustainability for this, that, okay, we know others are the experts, so let's have them fund the mental health piece and bring their individuals in for those services. So there was maybe some question about them reevaluating, but this program is not going away. They're just reevaluating how it's funded.
Any other discussion?
This funding is just for repair and upkeep on the existing property.
Correct, it is.
That's all that is.
Yeah, but there was some conversation that, well, are they even gonna be open? Are they shutting down this program? So I can
The
confirm that,
longevity of.
yeah, the program is not going away. They're looking at a different funding model so that the burden isn't all on them for salaries to do all of the work, that they bring in other programs to do some of the mental health services for the individuals that are living there.
I think we've covered that previously, if they do go, defunct, would that be the correct term? That we can recover on.
Yeah, but if they're defunct, it's kind of hard to recover it, so.
So there's a bit of a gamble, is what we're saying.
No, or well, what I'm saying is, no, they're being smart about it. They're not just continuing to be in the negative every year. They realize that.
Actually, it was nice of them to let you know about
Mhm.
Any other discussion? Okay, Pillars Incorporated, $50,000, roll call.
Egan,
Yes.
Damo,
Aye.
Cox,
Aye.
Barry,
that. Aye.
Borchert,
Yeah.
Belter,
Aye.
Oswald,
I,
Galloway.
Aye.
Discussion possible action begin process prioritizing selection and funding amounts for projects for spirit funding from the county government project categories.
This is the fourth quarter here.
Is that what that was?
Yeah,
Is that what that was? That's my
Yes.
thing? Well, I wish I would have prepared for that.
Me too.
Already. Well, I can tell you that we are working on an outdoor comprehensive plan, a spirit plan. To kind of go with the outdoor comprehensive plan that the park system did. Make sure that we're getting out to all areas of the county. Make sure that it's coming up with projects that are, reducing maintenance costs and making it much easier and cheaper for us to maintain what we have. That is not quite ready for prime time yet. The other stuff is really been working hard with, Mike Elder, on facility condition assessments. He wants to come and ask for, master plan space use. What we found out is we found out the condition of all of our buildings. He wants to know, are we actually maximizing our spaces? He thinks that we need to have space standards for office. Some of our offices are rather large. What are those space standards? What are we looking at? Are we set up to be the most efficiently? So I know he has a request he's working on, to come for us to really coincide with the facility condition assessment. And it's all planning and long range and making sure that Mike and Paul and everybody else has a vision, both Mikes and Paul have a vision on how we're gonna tackle this hurdle coming at us. That's about as far as we are right now, other than the sheriff's radios, which we already purchased, and the expo center project.
So any idea when you'll be getting to us? I mean, our next meeting, I think is scheduled for the 15th.
Wait a minute here.
Now, for now it is.
No.
Yeah.
Oh, well, if I may, yes, sure. You have provided a document outlining the capital projects that this commission should address. And I think what you're saying now is some of that needs to be dovetailed into a planning process.
Yeah.
Which would simply delay the funding of the money from this commission. And I'm not saying I don't support that. I certainly would support. I believe they said we had 108 buildings.
Yep.
Okay,
Including hangars.
maybe we could find a way to consolidate the services back into more of a centralized building system. Just a thought. But I do think we need to go forward with it, you know. Obviously, we have the aviation issue, which is my referral back. They'll be reporting back, hopefully, to this commission, seeking funding for the fire truck and other issues, so we
We
need to
may have
have
a
that
different view on
discussion.
that one.
Huh?
So we may have a different difference of opinion on that one.
Well, it'd be the first time, John.
Right,
That's-
no, I appreciate it.
That's the purpose of government.
Absolutely.
Yes. So I look forward to that discussion, so hopefully, we can get some things going.
Right.
And, once we start putting it on the table, and discussing things, that would be the time to, I would think, entertain. Just my thoughts, your perception.
So is there anything on February 15th that you'll have that we can meet on?
Nope.
Nothing at all?
Really? Nothing at all?
I mean, Paul is trying to get all these dollars out to everybody else, the neighborhood improvement grant, and
We've only got 3 townships left.
oh, I know. I mean, we're just swamped at work. It was hard for Adam to help, write all the agenda item reports, for Mary Ann to come up with 13 resolutions or whatever it is, or however many it's been in the last 2 weeks for us to really, we've been so swamped on making sure that we hit the deadlines of this every 2 weeks. Cause even though we have a meeting every 2 weeks, that gives me, Cassie and staff 1 week to prepare the packet. We don't have 2
And
weeks.
me.
And you,
I get
right,
my- I
and
get my
you.
part done.
Right,
So
yeah,
no problem.
yeah, looks good, right? Yeah. So yeah, and I don't wanna, that administrative 50% is so important. I don't wanna rush it. I want time for Paul and Mike and and other Mike to sit down and really look at the plan. You know, the next thing that I wanna bring here, if it's not the outdoor comprehensive spirit ask, right? Cause I think that's a little bit more close to being dialed up, is Mike Elder's space study plan that he wants to do. He wants to see what our efficiencies are. He's estimating right now, just off of back and napkin math, that we spend one whole position every day, every year, just on drive time from our facilities headquarters, if you would, to the north side of town where we do everything for Parkview. One position wasted in labor alone just on drive time. And these are things that he wants to look at and figure out. Part of his plan of, Mike, I've got this giant bubble coming, how do we address it? And they don't wanna rush that.
Can I not say to rush it, but, I get questioned, I'm sure some of these other ones do too, by a lot of the county board members. How come some of this other money isn't going out and being spent? Now, we got this year, but what about county? They were waiting to spend some of the money on the county things, and we're not getting that done. And so that's a lot of them that they're,
Well, you can say that, but, it's their dollars and they wanna know why they can't get them done and get them spent.
Well, so it's keeping these balls in the air.
Yes, that's right.
Why
I
don't
can do
we
that.
continue with the scheduling of the meeting, obviously minimize responsibility of your administrative staff here, but we have a list of all the projects. You've already given us that,
That was a wrong list.
so
You heard that, it isn't that anymore. Well, neither was veteran housing in this category, right?
maybe we should just start with the list you have and kind of discuss that list. And kind of go from there. I mean, I don't want to, I agree with the focus that Tom is referring to. We should not delay the expenditures of these funds. We should continue to appropriate the funds. They are ARPA funds,
No.
now called
ARPA
fair
funds are
funds.
spent.
But the intent was made clear by the commission. We need to pursue and get these funds out to where they need to go, including capital improvements. That's my understanding.
Yes.
I don't think that's exactly fair, since we all supported a land and water, conservation effort that takes 10 to 15 years to spend. So we
That's
have
true.
the absolute time to consider to make sure that we do that right, so we don't rush it all quick, because you wouldn't be able to get good projects, right? To have time for farmers to buy in and make sure that it's effective legacy change. I'm asking the same thing on ours, that we don't have to rush for a reason. I wanna make sure that we are doing the best that we can to accept and meet the challenge ahead of us with all these. We built a lot of things in the nineties all at the same time. I didn't do that. But those repairs are all coming at the same time, and we have to figure out a way to smooth that out the best we can. So if there is maybe 5 or 6 million, then I'm gonna ask to put off to the side for maybe more. Depends on what Mike says, as a capital improvement smoothing plan, to work the same way as that land and water plan did, to make sure that that's smoothed out for us a long time, and we have the best bang for our buck and the most effectiveness out of that dollars. I will absolutely ask for that, if it makes sense, much like the land and water thing. Sometimes I think, and I don't know if that's a fair comparison, that's just where I'm at.
I won't accept that it is a fair.
Let me get in, let me-
But given your premise, we got 13 plus million. So if you need 6, that should be a discussion we have. You gotta remember, in 2 months, you're gonna be looking at a new commission. Are you suggesting we're not even gonna have a commission?
And two people for sure will be going, or one for sure is going to go off this commission, possibly another one. So we know Tom said he isn't going to run, another one's got somebody running against them, and, you know, to put new people in here and have to have them start filing through, you know. I hope that these 3 here will stick with us.
John, I agree, the expanding the CIP and expanding that out rather than 5 years, maybe 10 years or whatever. Expanding the overall view of what you wanna do with building out and changing things and whatever. That's all good, but remember that every 2 years, losing a voting group that you've gotten adjusted to, and then you go to another one, and will they go along with that plan that you have? You see what I'm saying? So, I mean, really.
So anyways, if there's any way possible,
So we do still have 2 projects that the one is Menasha cost to move the Winnebago County Housing Authority office. And then the other one is Amro to hire MSA Engineering to conduct a drainage plan. I don't know, okay,
That's full.
okay, the
That was-
drainage
that was
plan
done.
one.
Yeah.
So is the Menasha one also to move the housing authority? I mean, that's still on here, so I just wanna make sure that this is accurate.
I'm looking at staff, I don't remember.
The MSA.
Yeah.
No, the MSA one was done, but the housing
Oh,
authority.
I'm sorry, yes,
Yeah.
it was a Menasha request for 150,000 to move the Winnebago County Housing Authority office to a new location. And then something with the Water Street plan of 4 million, are they moving because then they can sell the property or something? I don't.
Does that sound right?
Yeah, that's why they wanna, the city is encouraging them.
Oh, because then the city can sell the property and do their, street plan, something.
Yes, I mean,
I
there's.
don't know. I want to make sure that it doesn't get dropped.
Mary Ann?
And I'm not sure where this one is, but was there also approving money to upgrade the Winnebago parks, including remodeling the barn, improving boat ramps, piers, fish cleaning stations?
We passed that.
That was
Yep.
passed.
that was
passed.
passed.
That was passed at the last meeting.
324. 5,
324.
that's the amount. So topic is whether or not we need to schedule a next meeting.
Well, yeah,
Continue.
is there gonna be anything for the 15th?
Wow, that's what I don't know. I would appreciate a March meeting to give us time to kind of recoup, to figure out where all things lie, figure out where balances are. At March 5th, we will know what passes the county board or not too. So we will have a better, it's been really hard kind of playing in this limbo area and I mean, I would appreciate an early March meeting, still early enough to get on the county board and be able to find out what has been passed.
Addressing county capital projects.
No, just this, ARPA stuff, just the spirit.
Yeah, that's what I'm talking about,
Yeah.
the other bucket, the other side,
Before we,
county projects.
before we finish, I don't know if I'm ready for that quite yet, but we'll see what kind of discussion we can do.
Okay, this is discussion. When I get to the end of a large building project, I have my second to the last draw. You know, all the money we spent down to $926,000. By our next meeting, we'll have the rest of what's in here more or less defined, because we should have it after the county board approves what we recommend today. And then I know what my final draw will be. I put in a contingency in case there's any cost overruns, which we could apply to the interest earnings that Paul and I came up with. And then the balance could go back into the general fund of the county to talk about it for the rest of your terms if you want to, but I don't know that our involvement after the next meeting, maybe the next two meetings is needed, because we're not gonna vote on county expenditures that we know nothing about. We'll just say yes. So get our next projects defined by our next meeting after the county board tells us what we have left.
Yep.
And then approve another tranche, and then we move all the excess funding to the county budget.
I see what you're saying, but the three of you had such good input on even these votes that we have taken the county that I really feel.
Well,
Not going anywhere.
I don't know about that.
Will all these recommendations, will they all be able to go to the next supervisors meeting for a vote? In February?
I'll get it, you should be.
Yeah, you should
Well, I
be.
mean, the ones that you have, are the new mental health, we've got tri-county, community dental clinic, child care resource, and pillars.
And Nova,
No, that's easy.
and Nova
And Nova.
counseling,
And Nova was already done, Nova was already a resolution,
right?
okay? But the ones that I just referenced did not have resolution.
That's correct.
Right.
John?
Yeah, I think get those resolutions so we can see at least a clear finish line on that bottom 50. I'll talk to Mike Elder, make sure that he has his plan, whatever master plan request thing that he's working on done for that meeting. I'll also talk with Adam Brees to see if we're ready to come with that outdoor comprehensive. So I'm not saying no to anything. Some of the things that we already have worked on and almost complete. We just have a bunch going on to start something else on some of these others. Mike Elder, Director Elder is not ready to see what that number is that he wants, and it's kind of CIP thing, so I want to give him some time for that. So I can bring some things in a March meeting, absolutely.
What about then parks and that?
That's one of the ones I'm talking about. Yeah.
You know, we only have one meeting in February, and it is at the end of February, it's at the very end.
Yep.
27th.
Yep.
And I requested a potential second meeting in there just to make sure we could get through all the,
That was for the 15th.
Yes, I
Because we didn't
asked
know.
for that, but it really, the Oshkosh YMCA is still looking into their options. First Five Fox Valley is potentially waiting for some grant or another state project, and then YMCA of the Fox Cities is still, we're still looking into what's happening there. So really, we've covered everything other than maybe those two municipalities that maybe, I don't know if they are as time sensitive as some of the other building projects. So at least for me, I don't have an issue not having, because we covered everything, I think today that we had hoped to.
So just to clear, so the 5 that we did not have resolutions for, you would like to be brought forward at the end of February county board meeting, is that correct?
Yes. If we could.
Okay, so then. I'm sorry,
You need the resolution. Come back to
Or
this
new
body
resolutions.
before you vote.
Corpus novus.
That's what we've been doing.
I'm sorry, I didn't,
Do you need the resolution? I'm sorry.
Go ahead.
I don't,
The
I,
draft resolution, do we have to have the draft resolution back here? Or can we just go forward to the county board?
so the practice has been since we've been meeting to have the draft resolution,
Right.
so you all would vote on. But again, as you know, in earlier times that never happened. Earlier times meaning, but I would think for precedence, you would probably want to have the resolutions drafted so that you can all vote.
John?
Compromise. February 15th meeting, fine to go over the draft resolutions that everybody went on today, so I'm not putting. Mary Ann, it's a little stress on your staff, but can you handle these resolutions?
Yeah,
As long as
because
we don't have to write new agenda item
We have the
15.
agenda item, that makes it a lot easier.
We had that, correct. We got that all done.
Make it easier, and we just got a Supreme Court pre-filed yesterday.
Yep.
So we can do it in the next week. So this agenda, so what is the 15th? Next,
15th is a Thursday.
okay, so that means we would have to get out by next Thursday. We can do it. We can get those 5 done
Okay.
because we already have the other resolutions.
County boards on the 27th, not the 20th.
No,
That's correct.
no, it's the 27th.
For the
You got
election.
more time.
For the election. For the election.
What?
No, they're talking about having, what meeting are you talking?
February 15th
For us.
for this group to go over these resolutions that we
That's
just
the
passed.
third February, the third Thursday. We've got pay that this is tomorrow, and then we have,
Just let me.
Day after Valentine's and worse.
I don't.
Last.
So in other words,
First day
everything
of
has to be out by
It
the,
is,
so
Mr. Chairman.
we have hearings on the 6th. There was a jury trial on the 6th. The 8th, there's a contested hearing, and the 9th there was a trial. That means we would just have to focus on the 5th, and the 6th to try to get this stuff out, and since we have the agenda item reports and there are 5, I believe we can do it, yes.
Supervisor Fari.
Are we gonna have a meeting early March to address the other side of the ledger, capital, our county projects?
I would like to say yes, but I guess I'm gonna have to leave it up to John, because he's saying it's his committee, so,
That's not my committee.
well, it's up to your staff, it's up to your staff to get it done.
That's what a good boss does. When your staff is drowning, you pump the brakes.
Okay, well, then you better get it pumping.
All right. Trust me, I'm driving him. Adam is sore. I've been driving him. I've been driving everybody.
So it's on, we don't know.
So
I'll do my best to come up with.
we'll
something.
talk about it on the 15th, and maybe you can at least let us know when it can be.
This room is booked quite a bit, so Monday, March 4th, it's available in the afternoon, otherwise it's not available for the rest of that week. Or the week.
4th floor? Would this work for that?
Yeah, like country, you got that big office, but for now,
The training room.
well, we have.
Remember,
It's a big
March
meeting.
19th is the last county board business meeting for this term. If we don't get things resolved or presented to the board by that date, it goes to a new term,
A new
new supervisors, new commission, new everything. So that's my point.
There you go.
There you go. If you're even gonna have a commission. That's yet to be determined.
Well, as long as there's an ARPA, there'll be a commission, because that was stated before, that was set up before.
Yeah, there's spirit funds there. I think the commission still has to deal with those funds. They can't be allocated without commission oversight.
And that doesn't mean spent, just allocated. In your opinion, the land and water is considered allocated, right? Even though we won't spend it for.
Yes, that's correct.
So we'll be meeting on February 15th in this room at 1 o'clock. You want to hear that? February 15th, this room, 1 o'clock.
Gotcha.
Just the way we had it set up.
Gotcha.
We'll decide from there.
Is the agenda?
Okay, move to adjourn.
Second to adjourn, all those in favor signify by saying aye. Aye. Those opposed say nay. We are adjourned. Thank you much to all of you.
Order 4.
You're so.
I still go back.
So.